Hello, I'm Dr. Richard Brandon with BioLife MD located in St. Mary's, Georgia, 30 miles north of Jacksonville, Florida. Today, I want to talk to you about the importance of vitamin D. Vitamin D3, by definition, is a hormone. It controls 10% of our genes. If levels are above 55 nanograms per milliliter, it treats and prevents cancer. It also treats and prevents all autoimmune diseases such as multiple sclerosis, rheumatoid arthritis, lupus, celiac disease, chronic fatigue syndrome, ulcerative colitis, Crohn's disease, diabetes type 1, Graves' disease, Hashimoto's thyroiditis, peripheral neuropathy, psoriasis, restless leg syndrome, post-myocardial infarction syndrome, and many more. Vitamin D dissolves amyloid plaque associated with Alzheimer's disease, decreases risk of falls in the elderly, helps lower blood pressure, and is a powerful immune booster. It will decrease the risk of all viruses, including colds, flu, and hepatitis B, as well as bacterial and yeast infections. An excellent study at the Medical University of South Carolina in Charleston shows that when vitamin D levels are checked and corrected during pregnancy, there are significant reductions in preterm babies, low birth weight babies, gestational diabetes, pregnancy-related hypertension, preeclampsia, and C-section rate. It will also reduce the risk for the newborn of autism, diabetes type 1, asthma, upper respiratory infections, eczema, and more. Other benefits of vitamin D: it protects and repairs DNA, upregulates the production of serotonin in the brain, which is low in autistic patients and patients with depression. It upregulates the production of oxytocin, which is very low in autistic patients and is associated with social behavior. Vitamin D upregulates the production of glutathione, which is needed for detoxing high levels of mercury and heavy metals common in autism. Low vitamin D levels lead to an abnormal immune system, which is more likely to react to a trigger such as vaccines containing mercury or aluminum, fluoride, which has been added to our water supply, and bromide, which is found in commercial bread and Mountain Dew and other drinks. Government recommendation for vitamin D3 level is 30 to 50, and a daily requirement of 600 international units. Most benefits occur when levels are between 50 and 100. There has never been a case of toxicity with levels below 200, but the only patients requiring high normal levels are patients with autism or multiple sclerosis. Dr. Cicero Coimbra in Brazil treats MS patients from all over the world with vitamin D3, and 95% of his patients being treated have no MS relapses. Quite remarkable. Many primary care providers are not aware of the benefits of vitamin D3 and do not check blood levels. Most patients need at least 5,000 international units per day. My maintenance dose is 10,000 a day just to maintain a level of 80. The cost for 250 of the 5,000 international unit gel caps is less than $10 online. Bottom line, it is extremely safe, inexpensive, and has remarkable benefits. Why not have your level checked, especially if you are pregnant or planning a pregnancy? Thank you.